Hello to all my friends. Today we will speak about 10 types of psychological disorders which can affect common people. There are several kinds of psychological disorders. We can make it categorized into 10 important aspects, 10 important characteristics, and we can give name to those. And these are the 10 important psychological disorders or psychiatrical disorders which can be seen in general public. Number one is phobia. Phobia is intense fear. Intense fear about cockroaches, intense fear whenever they think about water, intense fear whenever they think about or worry about getting into an aeroplane, intense fear about going in an elevator or lift. All these fears can be categorized as phobia. They will avoid the circumstance. They will totally avoid the circumstance. Because of the fear, they won't even venture into that circumstances. That is called phobia. Then comes depression. Depression means we are totally without self-esteem, without self-confidence. We are always tired. We don't have interest in any activities. We don't have interest in activities which we were doing once interestingly. There could be sleeplessness. There could be excess sleep. All these symptoms are basically of depression. So I would like to give you one more information. All these psychological disorders are not self-diagnosable or self-treatable. You should take support from a psychologist or psychiatrist for diagnosis as well as treatment. Do not forget to subscribe this channel. If you want to get more videos like this, please click the bell icon so that you get more videos in your notification tab. If you have any question, you can always ask me in the comment box. I am always ready to reply your questions. The next is PTSD, post-traumatic stress disorder. Post-traumatic stress disorder, if a person experiences a traumatic incident in his life once or continuously for some time, after that particular incident, he may always think about that incident. He may always worry about that incident, even if he don't think that incident comes to his brain, comes to his thoughts and completely disturbs him with the symptoms of depression, with the symptoms of panic attack, with the symptoms of anxiety disorders, even with the symptoms of phobia. So whatever incident took place, that incident was over, but the thoughts of that incident, the memories of those incidents are haunting this person continuously. This is called post-traumatic stress disorder or PTSD. The next one is obsessive compulsive disorder. We will have an obsession, we will have anxiety, and then we will have compulsive behavior to overcome the anxiety. For example, if a person has fear of viruses or bacteria, he suspects that he has virus in his hands. Continuously he worries about the viruses in his hand. Because of the worry, he develops anxiety. This anxiety will become so intense that he will be compelled to wash his hand and make sure these viruses are cleared. After completion of the hand washing gesture, he starts worrying again. He starts obsessing again. What if viruses are still left? Bacteria are still left. Then he goes into another anxiety spree and then he starts washing his hands again. This cycle continuously repeats, and this problem is called obsessive compulsive disorder. The next psychological disorder is bipolar. Bipolar means there are two poles. The one pole is depression pole and the other pole is manic pole. These two poles, this person alternates his own behavior and thoughts in these two poles. This kind of problem is called bipolar disorder. There are several types of subcategories in this aspect. We will not go deeper into those aspects. I will be making some other videos regarding this. Please watch those. The next psychological problem is insomnia, sleeplessness or totally lack of sleep. If a person experiences total lack of sleep, and if the person experiences low sleep, less sleep, sleeplessness, it can be called continuously for some time, maybe 1 week or more. it can be called as insomnia. So insomnia is basically considered as a psychological disorder, but there are other areas also whereby some physical problems also can induce insomnia, and some medicine related side effects can also induce insomnia. The next one is eating disorder. In eating disorders, we have anorexia nervosa, we may have bulimia nervosa, binge eating disorder. We eat a lot, we may eat again and again, lots of food again and again. We may eat junk food again and again in lots and lots. Sometimes a person may not even eat at all for days, or he starts starving even when he is very low in energy, thinking that if I eat food like this, I will become fat. So these kind of eating disorders, it is also considered as a psychological disorder. The next one is schizophrenia. It's a serious mental disorder which affects a person, how he is feeling, how he is thinking, and how he is behaving. It affects all these aspects. It even affects a person's emotion. Disorganized thinking, hallucination, delusions, hearing speech which others may not be able to hear, doing things which others may disregard, disorganized speech, disorganized behavior pattern. All these are symptoms of schizophrenia. The next one is paranoia. Paranoia means intense anxiety and irrational fear of being under threat, conspiracy, or persecution. The person with paranoia may think that his room or his home is being watched by somebody else. In his room there are several cameras which are watching them. Somebody else is noting everything down. Somebody else can understand about his own mind. The other person can read his mind. Even he suspects his family members. He may suspect that my family members are poisoning me. All these kind of thoughts, all this kind of intense fear and anxiety can be part of paranoia. The next one is panic disorder. In panic disorder, after an intense anxiety episode, anxiety period, stressful period, a person experiences panic attack. The panic attack will be so intense that this person starts feeling that his life is in danger. The symptoms are such that he feels that his life is in danger. Then he starts thinking again and again that if the panic attack comes again, what I will do. This creates intense anxiety in his mind. Because of this intense anxiety cycle, he may experience panic attack again. Again he goes into anxiety cycle. Then again panic attack comes. If this continuously happens, several panic attacks in a short span of time, it may be called panic disorder. So panic disorder will be so intense that this person literally feels and worries that he has some physical symptoms, physical problems which has to be addressed as early as possible. So he may visit several doctors continuously, and even in spite of all these doctors saying you don't have any problem, this is just panic attack, you don't have to worry, but still this person will not be satisfied and he will go doctor shopping. So these were the 10 important psychological disorders or psychiatric disorders which you should be aware of. But this video is not intended for self-diagnosis or self-treatment. You should get help from psychologist or psychiatrist. Thank you for watching this video. Please subscribe this video and do not forget to click the bell icon. Thank you.